Hi, my name is Anmol. I'm a medical student, and too often I see my patients struggle to afford the medicines we prescribe them. I'm reminded of my patient, Mrs. J. In 2019, she was diagnosed with multiple sclerosis, a degenerative disease of the brain and spinal cord. For the past 2 years, Mrs. J has been taking advocacy, a new type of drug helping to slow the progression of this terrible disease. But when Ms. J lost her insurance due to the pandemic, she had to pay several $1,000s per month out of her own pocket, only to then find an increase another $300 in infusion this past July. And Ms. J is not alone. Just during this pandemic, drug makers have hiked the prices of over 1,000 prescription drugs. For years, patients, advocates, and physicians, including those with Doctors for America, have voiced the need for drug pricing reform. So today, I want to tell you about some of the federal proposals that we at DFA are keeping our eye on. In 2019, Congress passed H.R. 3, the Elijah E. Cummings Lower Drug Cost Now Act, a bill that would allow Medicare the power to directly negotiate prices with drug manufacturers. Estimates suggest that the passage of this bill would lead to $456 billion in savings over 10 years. This bill was reintroduced in the House in 2021 and awaits hearings in several committees. Meanwhile, the chairman of the Committee on Finance, Senator Ron Wyden, has led the charge on the Senate's version of the bill, introducing several guiding tenets for legislation as Congress writes its budget plan. These tenets would include allowing Medicare to negotiate drug costs, reducing out-of-pocket spending, and instituting affordable monthly limits for critical medicines like insulin. If included, these measures will have a direct positive impact on my patients' healthcare bills. These pieces of legislation and frameworks are not perfect though, and they raise some questions and concerns we at DFA are keeping an eye out for. While Medicare remains the largest purchaser of prescription drugs in the world, patients outside of Medicare in the U.S. are also facing challenges with drug affordability. It remains uncertain how savings from these plans will be passed on to these patients. We also do not know what medicines the government will be allowed to negotiate for and which will remain off limits. We do know the drug manufacturing industry is clear in their opposition to this legislation, claiming such measures will harm future innovation. But as a future innovation, I look to the facts. The research shows that we as taxpayers overwhelmingly finance the research and development of new medicines, while the big drug manufacturers spend more on stock buybacks and marketing, not future innovation. In fact, all 356 drugs approved between 2010 and 2019 had NIH funding behind them. My patients should not have to pay twice, once to subsidize the development of their medicines and second at the pharmacy counter. This is why we at DFA believe that exemptions for the small biotech or pharmaceutical companies will only limit our ability to make medicines more affordable for our patients now and in the future. It is beyond time we reform a system that continues to fail our patients. As we look to see what provisions are included in a final bill, we have an opportunity to ensure drug pricing reform is as meaningful and effective as it can be for our patients. So join us at DFA as we write a prescription for a healthier America.